most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, let's see if I can say this.
That's right, Bob.
3 quick tricks to help take away your knee pain.
3 quick tricks.
Yes.
Well, so we're doing tricks now.
We're from Wisconsin and Minnesota where they have quick trips.
Which is a convenience store.
So we were going to try.
Yeah.
I kept saying that.
It just kind of comes out.
So real quickly, these are knee things you can try. If they help, they should make your knee pain feel better.
Mm-hmm.
It should feel better afterwards. It should feel better while you're doing it. If it doesn't, don't do any of these.
Right. So don't get real aggressive and think you're going to work through the pain.
Right.
If it hurts, stop.
Right. Let's do the first one. The first one is just very simply, I'm going to have you bend the knee like this into flexion, bend, and then relax. Pressure on, pressure off.
Right.
And you can do 10 of these, and you could do these like 4 to 6 times a day.
Sure. Now, again, if it makes it feel better and you get better range, and it's best to do in a firmer chair.
Yeah, and slide your butt forward.
Help.
Yep.
And then
now here's an advanced version of that.
Ooh.
You can, or even you could try this right away, is just stick a towel under the knee and go like this.
All right.
And again, pressure on, pressure off. This helps gap the knee.
Yeah, it takes that joint and opens the space a little bit, allowing some more synovial fluid to get into that area which needs lubrication.
Now we're going to show you one other alternative.
Yes.
You can actually, this is the Mulligan technique.
Brian Mulligan.
Made for Brian Mulligan. And Brad's going to show that. You're going to put your leg up on the chair, Brad.
Okay, yep.
And
I'm going to get it this way so we can get a better view. I feel more comfortable. So this would be the knee I'm working on.
Sure.
Again, a firm chair, not a soft, squishy one. Works better.
Now, what a lot of people don't realize is your knee doesn't just hinge. It also, this rotates the bottom leg. Well, you got the road rash there, Brad.
Oh, you got to be careful. That's why I like people to be careful. If you're riding your bike, you fall down, this is what happens.
Yeah. So if you put the right leg up, you're actually going to twist this lower leg and help it move a little bit clockwise.
And this is kind of,
right?
if you grab your skin, just your skin moves. So you need to kind of try and think about getting some pressure on
that's
there.
counterclockwise, isn't it?
If I'm looking down at it, we're going counterclockwise.
Okay.
So
either way, what you do is you turn it towards the other leg.
Right. And you start with your toe. If you point your toe that way a little bit, it helps. And rotate.
But he's turning it the entire time he's bending the leg. So
the idea is if you do it like this, it kind of hurts.
Right.
And then you do this, and it's like, oh, that feels better. I can go farther.
The movement the accessory movement is supposed to do. It's hard to explain, but it can help. I've had people who've had meniscus problems or cartilage problems, and it's helped them.
Sure.
Now, if you're doing the other leg, you also turn the leg. You want to throw up there, Brad?
So we're going to turn
the leg again towards the other,
and then rotate this
towards
way.
the other leg.
Yeah. Would you ever consider going the other way and rotating the other direction, or is that?
Well, that's not the normal movement of the bone when you're bending the knee is internally rotating.
Right.
So
yeah, we're going to go with that.
Yeah.
And
I'm not saying you can't try it. Who knows?
The idea is if you do try, you're only going to do it if it feels clearly better when you're doing it and you get more range of motion with less pain. Follow the rules.
All right. All that was exercise number 1. Now exercise number 2, we worked on bending the knee. Now we're going to work on straightening the knee.
Oh, yes.
So you can actually just go to the edge of a chair like this and push down, pressure on, pressure off, pressure on, pressure off. You don't push it on the knee itself. You're above the kneecap.
Yeah, because that way you can relax more. And if you press on the kneecap, it can be a little uncomfortable in itself.
The variations you can do with this, Brad, is you can actually, I don't know if you can catch this, you can turn your foot out and try pressure on, pressure off, or you can try turning your foot in, pressure on, pressure off. You want to gauge which one of these feels the best.
Right.
And the same thing, you can do like 10 of them and 4 to 6 times a day. All of these you got to do quite often. That's where you get the benefit from.
Right. Yeah, they don't take long, and they should always have the same feel good. You can use a stool. I've had many
Stool with a
patients.
rolling stool works really
Yeah,
well.
if it's a stationary stool, not quite as good.
Yeah.
But and then
It'll
you,
still work.
yeah, lean back and do that. Some people find this a little more comfortable.
Sure.
It depends on your situation.
My wife, I mentioned this in other videos. She actually had best luck when she turned her foot out. Like
Sure.
this.
Yeah.
Really made a difference.
Externally rotate.
Externally rotate.
Mhm.
Okay, the final exercise is actually a new exercise by Robin Mckenzie in his book, How to Treat Your Own Knee. And what they do is they have you put a pillow down.
Yeah, there's the
There
book.
it is, the book. You get down on your knees in the quadruped position like this.
Hands and knees.
Yep. And then you start working your way back. And you're stretching the quad and you're stretching the into flexion. And you have your heels up like that. And you're trying to get to the point where you actually sit on your heels like this.
So you're going to be on your toes.
Yep, on your toes. Oh, I'm sorry. They did it the other way, didn't they?
That's what I thought.
You're right, Brad.
I didn't want to
You're right.
rain on your parade, but yeah.
Mine are so tight this way.
Yeah, so
I have more
actually,
problems at the ankles than I do at the knees.
you're stretching your knee, but you're also stretching your
the foot.
ankle and plantar
Yeah.
flexion,
Right.
which is, can be beneficial.
So again, if painful, you're not going to go all the way. Maybe you can only go this far.
Mhm.
That's fine. Do that for a while.
Bob, stay right there because I'm going to
Sure.
suggest some people who are tighter or they just
Good. I know where you're going, Brad.
Yeah. You want to put that in there?
No, that also, but you could also go like this.
Oh,
Brad.
there you go. Yeah, put it there.
You
That
could go like that.
Yeah.
That would be better on the knee. This would be better on the ankle.
Yeah, it all depends on where you're. Or you could put out one here.
Oh, that does feel good, Brad.
Here, well,
Thank you very much.
Yeah, wait, let's
Oh,
double
here we
up.
go. You double
So,
up.
yeah, there you go.
Woo!
So
Here
you
we
could
go.
you could start with there and take
Yes.
one pillow out at a time.
This is the Heineck technique. I'm going to name
Well,
it
no,
after you.
yeah, but we can't butt into Robin
Mckenzie?
McKenzie. There, I would not ever do
He's
that.
the guru.
Yeah,
So-
he's the master.
All right, give those a try. And if they're painful, you don't do them. Remember, are we giving away something today, by the way? All right, we're giving
Oh,
away.
yeah.
This is a good device for someone with knee pain. So this is a massage gun.
Right.
It's our highest end massage gun. This is the one.
It's the most powerful one.
Right. It's probably geared towards athletes to a large extent.
Right.
And it comes with 5 different heads. This one actually is a metal head. It's the only gun that I've seen that has a metal head.
It's stainless steel, Bob.
Right. I guess you could heat it up too and cool it down, but I don't know what that is purpose that would serve.
Well, I think that's
But-
a marketing
And
thing.
it screws on, so it really stays
yeah,
on.
it's threaded on
But
nicely.
I'll tell you, this gun is powerful. If you're having problems, boy, I
Yeah,
just hit
put it.
my mic.
Yeah, put it on your mic. That'll be good for the mic.
That'll be good for the mic.
Again,
So-
if you look at our videos on how to massage a knee, you're not going to go on the kneecap or the
Right.
bone. That's just going
You
to
massage up or down.
the muscles above,
Or the muscles
quads,
below,
hamstrings,
right.
calf muscles.
Yep.
They all deal with the knee joint. Support it.
Yep.
Wow,
So
Bob.
go to bobandbrad.com, go to the giveaway section,
Oh,
and
that's
you can sign up
right.
for a contest.
The
You can also go to
contest.
Bob and Brad on Facebook. It'll be placed pinned to the top of the
Top
page.
of the page.
And
yes.
you can also listen to our podcast.
The podcast, exactly right, Bob. We've
has
got
nothing to do with this, but
experts. But Bob, I do want to mention because we do have a number of English majors that do watch and correct
Right.
us and help us out. I think to get the podcast, they should write a little essay about why they want one. And then we can read it, and then we can read it to the whole crowd.
we're not doing that. We can't even judge it. How we do?
We'll figure something out. These English majors, they love to write, Bob,
Okay.
and that we can learn.
All
This is a
right.
learning
Thank
station.
you for subscribing to our channel, by the way, English majors.
Be careful.
Yeah,
Be
be careful.
careful in all that you do.